Hello, and welcome back. In the first video, we talked about more common types of rashes in babies and children. In this video, I am going to talk about other rashes that are seen in babies and children. Please don't forget to share our videos. We are hoping to reach more people with these videos so that other people can also benefit from this information. Eczema is a common skin condition in babies and children. This usually causes dry, scaly or cracked and itchy skin. Eczema is more common behind the knees, elbows and neck. Eczema is a chronic condition and requires an assessment by a doctor for proper management. The usual treatments for eczema are emollients, steroid creams, and antihistamines. A raised rash with itchy spots, patches or hives is likely due to an allergic reaction. Mild allergic rash can be treated at home with observation. An antihistamine such as chlorphenamine can be considered if there is itching or irritation. If there is a more severe rash, swelling around the mouth, cough or breathing difficulties, urgent medical help should be sought. A rash that looks like a ring-shaped patch of skin is likely to be ringworm. This can be itchy, dry, scaly or swollen. Ringworm can appear anywhere on the body. A ringworm can be treated at home with an antifungal cream, gel or spray. If there is a rash with small, raised bumps that feels rough, this could be due to scarlet fever. Scarlet fever usually starts with a fever, a sore throat and swollen lymph glands in the neck. A rash appears 12 to 48 hours after these flu-like symptoms. With scarlet fever, there could be a strawberry tongue sign where it would look red, swollen and covered in small bumps. Although the actual rash does not appear on the face, the cheeks can look red due to illness itself. It is recommended to contact a doctor if there are symptoms of scarlet fever, as this is usually treated with a course of antibiotics. If there is further illness or symptoms weeks after scarlet fever got better, this could suggest a complication such as rheumatic fever and further medical assessment will be needed. Impetigo is characterized by blisters or sores that burst and leave a crusty, golden brown patches, mainly around the mouth. The red sores or blisters can be itchy and painful, and spread to other parts of the body. Impetigo is very infectious. This is usually treated with topical antibiotic creams or oral antibiotics. Scabies causes a very itchy rash with raised spots, which may first appear between the fingers. Scabies in babies and children usually affects the feet and hands, often with blisters. The treatment of scabies is with 5% permethrin cream or 0.5% aqueous malathion. A rash consisting of small, itchy spots that turn into blisters and scabs is usually due to chickenpox. Chickenpox rash can appear anywhere on the body, including inside the mouth. Before or after the rash appears, there may be a fever, loss of appetite and aches and pains. Chickenpox is usually very itchy, and this can be distressing for children. Chickenpox does not normally cause a major illness in children. They should stay away from nursery, school and crowded places. Paracetamol can be considered for high temperature and aches and pains. Children should be encouraged to drink plenty of fluids to avoid dehydration. Cooling creams or gels and an antihistamine can be used to help itching and irritation. Ibuprofen is not recommended in chickenpox as this may cause serious skin infections. A more serious rash that can occur in babies and children is measles. This presents with a spotty rash on the head and neck and spreads to the rest of the body. Measles can start with a fever, cough, runny nose, red, sore and watery eyes. The rash usually appears a few days after these initial symptoms. There can be white spots inside the cheeks and on the back of the lips. Measles is not very common due to childhood vaccination program, but if there is any suspicion of measles, urgent medical assessment should be sought. Measles is very contagious, and it is advisable to avoid contact with others until this is fully treated. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.